Welcome to In the Waiting Room with Drs. Yaz and Sam. Today I'm going to talk about egg freezing or oocyte preservation. So in 2013, the American Society of Reproductive Medicine declared that egg freezing is no longer an experimental technique and that it did result in a significant improvement in reproductive success. So why would you need oocyte cryopreservation? Because fertility, particularly the oocyte reserve, decreases with every year as women get older, particularly after the age of 35. And both the supply and number of eggs decreases, and the number of follicles produced in each ovary every month or cycle decreases as you get older. And the quality of the eggs that eventually would be successfully impregnated also goes down. So if you're thinking about getting this procedure, the one important thing to know is that it's better to get it earlier rather than later, because it's going to cost you the same amount to get it done. And if you're younger when you get it done, then number one, you hopefully could get more eggs, thus getting a better yield and more for your money. And also the quality of the eggs is better. So it's a known fact that eggs that are, the success rate of the pregnancy rate depends on the age at the time of the egg retrieval, or the age of the eggs as well. So I think that's really important to know, because you may not think about it until you're in your mid-30s, but actually if you haven't found someone in your late 20s or early 30s, you probably should just go get a consultation at that point so you can make a more informed decision. And basically the way the procedure works is that first you should make a consultation with a reproductive gynecologist. And they will basically, go over some numbers with you and kind of go over the success rate and how the overall procedure works and how often the clinic visits will be. And then you'll probably have to get some labs drawn before you start. They just want to sort of check that, you don't have any other major medical issues. And potentially work up any genetic conditions that might come up at that time before you start this process. And you'll probably get a baseline ultrasound to see, how many eggs are in each ovary to begin. Now, one lab that they draw that is really helpful is the anti-Mullerian hormone level. And this level or lab that they draw tells you kind of how responsive that you'll be to the egg freezing process. And it also is good to know this number because it kind of can tell you where you are in terms of the average spectrum and your ovarian reserve. So that's another reason why, personally, I think that the earlier you see a reproductive gynecologist, even if you choose not to have the procedure, is that you could at least get your labs checked, and then you could decide based on that information, including your AMH level, as to whether you want to get the procedure done, earlier rather than later. So I think it's really important. And unfortunately, your regular gynecologist usually doesn't routinely screen. They don't usually draw the anti-Mullerian hormone level. And so you have to make an appointment with the reproductive gynecologist, usually if you want to get this information. And I feel like the more information, the better, because why not, do the procedure at optimal timing if you can, and get the most out of it. How does this procedure work? So actually, I have to tell you, I had it done, and it's not that bad. Everyone, thinks it's such an ordeal or involved process, and I personally thought it was very doable. Basically, you'll get the consultation done, and then they'll usually tell you to come back on day 1 or 2, day 2, or of your when you start your next period, or when you're ready to do the egg freezing. So when you start your cycle, you go in, and they'll usually draw some labs, and they'll do an ultrasound. So at that point, based on what the labs show and your ultrasound shows, they'll basically come up with your medication regimen. And there's a couple of different ones that they can use. So your doctor, the reproductive gynecology specialist, will probably go over the best one for you. And then, depending on your regimen, you basically start. So sometimes, for example, I had a regimen where I took OCPs for a certain amount of time period, like on average, anywhere between 1 to 3 weeks, to sort of suppress your ovaries, your follicles. And then after that's done, or you basically start the ovulation induction. So this is when you take the medications to stimulate your ovaries. And you basically usually take like 2 to 3 on average simultaneously. And these medications are almost always injectable subcutaneous medications. They are not oral pills. And so but they're really they're really easily administered. So you'll usually have a little teaching session in the office to teach you how to administer subcutaneous medication. And they're really tiny needles. And for example, one of the medications, like Follistim, has a pen, and so it's really easy to use. You basically get this pen that's reusable, and you insert the vial, which you buy. You put the vial right here, you screw it back in, and then you attach the little disposable needle. Once you're all ready to use it, so it's really easy. You basically just attach it there. It'll click. Then you pull it off the cover. You have the very tiny needle. So you can see it's really tiny. It doesn't really hurt that bad. And then you can dial to the dose that you need. So you have the little dial, and then whatever dose you're on, you just dial it. And so then you can they'll teach you, but basically you choose the area of the subcutaneous fat that you're going to go for, commonly in the abdomen or like the side flank, the hips, where there's more fat. And then you clean the area with some alcohol, and you literally just push down. Now, I can't push down right now because there's no vial, but you just push this and it'll automatically set it to the dose. And that's it. And then you basically dispose of the needle into a Sharps container, which you'll get from the pharmacy. So you're going to basically continue the ovulation induction for a certain time period, which can vary depending on the person and your response. It can be anywhere from, 4 days to 10 days or more. So and during this time, while you're on these ovulation induction medications, you're going to be seeing the doctor on quite frequently, maybe like every 2 to 3 days, and they'll probably repeat the ultrasound to see your follicles and if they're changing in size, which you want them to enlarge, and they'll be checking your serum labs. So that'll tell them how you're responding. And then once they have determined that your follicles have grown and are the appropriate size, they'll give you the date for the egg retrieval. And they usually will only know about 1 or 2 days before. And so once you're set for your egg retrieval, they may or may not give you another medication, one additional medication to administer subcutaneously right before the egg retrieval at a certain time period, depending on your regimen. Okay, so the egg retrieval. So before this, you're going to consent. Some things to think about. They may ask you, what you want to happen with the eggs, if in case something happens. So just think about that before you, go sign the consent. And then basically, you're going to go to the either office or ambulatory surgical center, and it's an outpatient procedure, and it'll be done under anesthesia. And it's basically a transvaginal ultrasound aspiration of both ovaries. And the procedure itself, on average, takes, 15, 20, 30 minutes. and you're under anesthesia. So personally, I had this done. I didn't feel anything. The anesthesia worked great, and it was really quick. I think my doctor, I was out of there in 20, 30 minutes, and then they watch you for a little bit, and then you're good to go home. And then what they'll do is that they retrieve all of the follicles in both ovaries, or as many as they possibly can, usually all. And then they will inspect the follicles, and they can only freeze mature eggs. So they basically will freeze any mature eggs that day. And if some are not mature, they will watch them for a day or two to see if those mature. And if they mature, they'll freeze those as well. So the key is that ideally you want to freeze as many eggs as possible, because as you'll see when you go in for your consultation, oocyte cryopreservation has a pregnancy success rate, which basically it's not that high per individual egg, but you can maximize it by freezing more eggs. So, and it can range. Like I said, it is really variable depending on the quality of your eggs and the age that you are. And you won't know until you actually try to get pregnant and use the egg. So you may even decide to do several cycles if you need more eggs. And you and your doctor can decide that as you go over the numbers and you consider what's best for you in that sense. And now there is some side effects of taking the medications. The main one is ovarian hyperstimulation syndrome. Your doctor will be monitoring you during the process, and so hopefully they would notice, but basically that would cause they would adjust the medications accordingly if they felt like you were at risk or developing that. After the egg retrieval, you may have some pain. There are side effects of fever or vaginal bleeding, difficulty urination. I mean, those are less common. The main ones would be a little bit of pain, and then the ovarian hyperstimulation syndrome as well. And the symptoms of ovarian hyperstimulation syndrome include abdominal pain, nausea, vomiting, bloating, and diarrhea. The risks of the retrieval are just like with any surgical procedure, including bleeding, infection, damage to the bowel, bladder, and blood vessel, although those are less common. And there's always risks with anesthesia, whether it's done under conscious sedation or general anesthesia. There's always a risk of anesthesia, and so your anesthesiologist should discuss those risks with you prior to the procedure. And there is, some emotional risk because the procedure, basically you're going to learn a little bit more about your fertility and the fact that, it may not be successful later on. So just something to be aware of. And the medications could also cause you to be a little bit more emotional, and they can cause some weight gain. So anyways, I hope that sort of helps the overview of how oocyte preservation works. It is, on average, I'd say it's at least a 2-week process, but it can range anywhere between 2 to 4. So it's something that you should take care of earlier rather than later, because the process itself takes a while. And if you want to repeat cycles, you'll usually have to wait at least a month between cycles, and then wait for the following month to get your period again. So it'll be like 2 months later. So again, that's why if you are thinking about doing this egg freezing procedure, I would encourage you to go see a reproductive gynecologist as soon as you can, because basically for the reasons I mentioned above, it's better to do it earlier rather than later. Now, this procedure is not covered usually by insurance, although some do. And so if yours covers it, you're very lucky. If it doesn't, you can pay for it out of pocket, and they usually do make you make the payment before they do the egg retrieval. And there are some programs, either at the clinic as well as through the pharmaceutical companies, to help it's aid-based to help you pay for the procedure. So definitely ask about that when you go. And on average, the procedure costs anywhere between $7,000 to $16,000, and this is the total fees, including the medications. And again, that fee varies based on how much medication you need and for how many days you need to take it, as well as your facility fee and your doctor's fee. So you can, and they can usually tell you exactly, pretty much, at least the facility and physician fee, how much it's going to be on day one, and then the medication fee is going to be variable depending on how you do. So that's about how much it costs, and I'm hoping that one day these insurances will help at least contribute to some of that cost. Now, another thing to go over with your doctor, aside from egg freezing, is embryo cryopreservation. So this is also another option, and what this is that you take the egg that is retrieved and you fertilize it immediately with a sperm. Now, the sperm could be from a partner if you have one and you're pretty sure that you want to have the child with that partner in the future. You can use them, or you can use a donor sperm from a bank. Those are the main two options. And so with this method, basically they fertilize and they freeze only the embryos that are successfully fertilized, and essentially, toss or don't freeze the eggs that are not fertilized. So the number that you get will be maybe slightly less. However, the success rate of the actual frozen embryos would be a little bit higher than the overall success of each individual egg if you did just egg freezing. However, the drawback of this is that, you have to basically either use donor sperm or, sperm of a partner. But if you don't know, if you guys end up breaking up later or you're not together later, the drawback is that you're kind of stuck with that. Whereas the egg freezing, it's more open. So just something to be aware of so you can discuss both options with your doctor. And I hope this helps. Let us know if you have any comments.